Come back and thank you for staying with us. This is the second hour of a news check. We want to focus on World Cancer Day that will be marked tomorrow, the 4th of February 2026, across the country, where we'll join the rest of the world in marking this particular feat. And you do know it is a day that is being observed every Wednesday of the 4th of February 2026. This year marks the second year where a 3-year theme has been going on. That is the United by Unique campaign 2025-2027. Given that Kenya faces a growing cancer crisis with approximately 44,000 to 47,000 new cases are reported on a daily basis. Over 27,000, 32,000 deaths have been reported annually, making it the third leading cause of death in this particular country. But the people who are greatly affected are the women of this nation, who are disproportionately affected with breast and cervical cancer as the leading types, while the men are primarily affected by prostate, esophageal cancer as well. The crisis is fueled by late-stage diagnosis, limited specialized care, and the rising lifestyle-related risks, especially within the urban settings. Joining us at this particular morning to converse this particular issue is Dr. Joseph Mageto, the resident doctor at HCG Cancer Center. Welcome, Dr.
Thank you so much, Abdi Aziz.
And also, we're keeping tabs on other stories currently making headlines at this hour. As and when we get those particular links, we'll be sharing them with you, including where President William Ruto will preside over the launch of the National Electric Mobility Policy, where Alan Aoko is covering that particular event. As and when we get those links, we'll be sharing them with you. But, Dr. I want to start by asking, tomorrow we'll be marking as a country and joining the rest of the world in marking this particular day. What will be the significance of tomorrow?
Well, I want to say that tomorrow, as the World Cancer Day, is a day that reminds us, as Kenya, as the world, that cancer is a big, big challenge all over the world. It affects everyone, it affects communities, it affects individuals, and we need to come together to fight this thing called cancer. Yes.
And you can see the country, we're facing this growing crisis of cancer. Tell us, given that we're in Dr. what are some of the contributing factors that are leading to the rise of these numbers?
Well, there's so many contributing factors. First of all, we need to understand that cancer is cells in our bodies growing at a very rapid rate, and they're not functioning as they're supposed to be. Some of the contributing factors to this cancer being an epidemic in our country involves many things. First of all, we look at environmental exposure. Some people are exposed to chemicals, maybe where they work, or maybe in the environment, maybe some pesticides, some fertilizers. Also, we do have what we call genetics, okay? There are some cancers that they are, people are affected based on their families. So, for example, some people with breast cancer, you might find that in their family, the mom had breast cancer, the auntie had breast cancer. So these factors, they combine to make this an epidemic. And we need to understand that in our country also, we don't do a lot of screening and we don't do a lot of prevention. Okay? Most people, they only go to hospital when they feel sick. And now that makes it bad because they come to hospital when the cancer is already progressed. We're talking about stage 3, stage 4. And this makes it very tough to treat. Okay? Yeah.
And you see, major of the contribution when it comes to something that has fueled this number, you can see one of those issues is late diagnosis.
Yes.
So in terms of, because we know our culture, especially for us men, until you fell sick is the time you go to the hospital. Then what are some of those, let's say, symptoms that one can pick out to go to the hospital before it reaches that 3 or 4?
Okay, thank you. Well, I want us to understand that cancer in itself affects anywhere in the body. It can affect the brain, it can affect your small toe. Okay? So if we're talking about symptoms, there's so many symptoms which one person can have that might be indicative of cancer. But for, let's say, the top cancers in our country, that's like breast for women.
Yes.
You know, having a lump in your breast, okay, having pain in your breast, having discharge from your breast. These are some of the signs for cancer, okay? For, let's say, for men, having problems urinating because the prostate has grown big due to prostate cancer. These are some of the signs that you need to look out for. For other cancers like cervical cancer, which also is very common in our country, having bleeding and discharge is not normal. So once you see such symptoms, you really need to go to the hospital. If you have difficulty, if you're losing weight, okay, difficulty swallowing, these are some of the signs and symptoms that you need to go to hospital. Yeah.
And in terms of lifestyle, given that the world is changing, how has lifestyle contributed in these figures that we're talking about in cancer, especially in a country?
Yeah, thank you. You see that our lifestyle has changed as in the country. We're trying to be more westernized. So we're looking at people smoking, okay, exposure to tobacco, cigarettes. This leads to having high cancer, okay? We're talking about shisha, we're talking about vaping, okay? These are risk factors that can make you get cancer, okay? Also, our diet has changed a lot. We're eating a lot of processed foods, okay? These are sausages, these are like salami and bacon. All these processed foods, what they use in making these processed foods or preserving them leads to also cancer. So we're looking, these processed meats, they've been graded as WHO grade 1, and most people don't know, but eating all this can put you at risk. Also, we're looking also at people not exercising, okay? Most people travel by cars and they don't go to, they don't exercise, and this can also put you at risk of getting cancer. Yeah.
And also in terms of the cases, we've seen majority of the cases are coming from urban centers and not in the rural. What could be propagating that difference?
As I said before, if you look at the urban centers, we have a lot of exposure, environmental exposure. Okay, we have people smoking, we have this environmental waste, okay, from factories, from homes that people are getting exposed to. Looking at the lifestyle also, people are living a sedentary lifestyle. They don't want to exercise. They walk a lot. They don't walk a lot. They don't go to the gym. So this contributes. Also the diet. If you compare the diet in the urban and the diet in the mashinani, it's very different, okay? A lot of our diet is very poor. We're eating processed foods. As I said before, the sausages, they also contribute to this, the smokies and all that, okay? So if you combine all this, you get now a higher risk compared to people who are living in mashinani.
Dr. you've just mentioned some of the best foods Kenyans do enjoy every day. So what do we eat at the end of the day?
Well, you see, the processed foods, I know they really taste good, but we also need to look at what they use in the preservatives. The preservatives they use in these foods. They use nitrates, and some of this, when they get into our body, they make the cells to grow rapidly, and this can lead to cancer. Yeah.
Okay, Dr. And of course, if you're just joining us, we're focusing on World Cancer Day that will be marked tomorrow, where Kenya will be joining the rest of the world to ensure that we discuss this particular issue. But first, before we continue with this particular conversation, I want to take you to a function that is currently happening in the capital, where the National Climate Outlook Forum prediction of the season weather focus is currently ongoing, with the theme of the two-day conference is from crisis response to climate preparedness. Let's listen in and hear what the Kenya Meteorological Department is saying in that particular.
So that they can anticipate, so that they can prepare well coming forth in the next 3 months what needs to be done. So we are happy that we have the agriculture, energy, various sectors. We have development partners who are going to support us even as we move towards the next 3 months. So we are, hoping for the best, but also anticipating in case of anything that would happen, that we can prepare well for the people of Kenya, and we can address any concerns in a whole of government, whole of society approach, leaving no one behind, the vulnerable, the needy, so that everyone is really benefiting in the months to come. Yes.
Oftentimes when you have a long period, you experience flooding in most areas in the country, and some areas such as Murang'a we have landslides. Are we prepared this time around to avoid such incidents?
Yes, so we've been able to map out. What we are doing is being able to map out, engaging stakeholders where we are anticipating things like the landslides, etc., so that they are fully engaged and are preparing well. And as you've heard, it's really a multi-sectoral, whole of government approach when it comes to preparedness also, and also acting forward. So we are engaging, and what the information does is that from regional, it trickles down to national, down to county level, and to the ward level. We also have our experts at a county level who will now be working with the various sectors to ensure that everyone is well informed of the climate outlook and prepares well so that we don't have any disasters in future.
You mentioned you were in Isiolo and the situation looks bad. Maybe you can give us a picture?
Yes, well, in Isiolo we were in a wetland region, and for the wetland area, you can see that because of the drought situation, communities are really moving to find, solitude to find something in the wetland area. And you see what that brings about is some conflict among various tribes and counties. So what we were encouraging is a joint meeting among the governors to see how all of them can, work together so that everyone benefits. But equally, how do we protect? Because when you look at the drought-prone regions, the ASAL regions, whatever wetland we have to ensure that we are protecting it fully, because it actually serves the ASAL region and the communities that would be impacted more. So that was really what it was all about. But you can see that the situation is dire. And what we are doing as a government is that we are ensuring that we are working together. We had special programs representation. We had our Waziri from ASAL region represented. We were able to distribute food to the vulnerable communities, and with the support from the commissioners to ensure that everyone, we are fully mapping everyone, and everyone is really benefiting from the current government, and really looking at other interventions that should come up, like climate smart agriculture, among others. So the communities were happy to see that the government is involved, the government is reaching on the ground. We are engaging with various cabinet secretaries, the technical teams, to ensure that the impact is felt on the ground, and that communities are not left there vulnerable. Food is reaching them, and addressing the issues of climate smart agriculture, and seeing how we can capacitate the communities at grassroots.
Yes, that is the Environment Cabinet Secretary Deborah Baraza, who just attended a National Climate Outlook Forum where key stakeholders like the Kenya Meteorological Department are attending to give a seasonal weather forecast of the country. The CS has confirmed they are mapping out the country to understand what is happening, especially when it comes to climate conditions like landslides, and especially the ongoing drought that she has clearly stated the situation is dire in the ASAL regions, where the government has come in to distribute food and other reliefs to the people who have been affected. And of course, they have clearly stated that given that the ASAL regions are experiencing that particular drought, they will be moving in to areas of the wetlands, which she clearly stated could bring an element of conflict. She's speaking to the governors to ensure that is not the case, to ensure even the little resources that are there are shared among the people of those particular regions, especially from the ASALs to the wetlands. Our reporter Jal is following on that particular story and will tell us more in our subsequent bulletins. If you're still joining us right now, We're focusing on World Cancer Day that will be marked on the 4th of February 2026. That is tomorrow. And the theme continues for 3 years now, from 2025 to 2027. It comes to be the United by Unique. And maybe let me ask you, Daktari, why has the theme remained the same? What are you trying to achieve? Not only the institution that you represent and the many stakeholders are in this particular sector, but the theme has remained that way for the last 3 years. Why is it the case, if you know?
I think the theme United by Unique is a very broad theme, and it focuses on the patient. Okay, everyone who is diagnosed by cancer needs to receive individualized care. That means you get treatment as an individual. You're just not a statistic. You're just not a number in the books. You are an individual. You need to get treatment that is focused on you and how you respond to it. So that's the reason why for 3 years we've had the same theme. Cancer is what we call a chronic illness. Most people have it for a number of years, okay? And the journey itself is not easy. So we need to focus on the patient in terms of our treatment. Yes.
And now coming to the treatment itself, because you see when people hear, especially us as Kenyans, regular screenings, checkups, it involves money.
Yeah.
So how can we make it cheaper for people to go for these regular screenings?
So thank you so much. Currently, I'd like to say that our screening as a country is very, very low. We're having screening of less than 10% abroad across all the cancer, all the patients we have, which is very sad in our country. A lot of people, the ministry and a lot of organizations have really come and tried to make screening as cheap as possible. This includes getting partnerships with organizations. We also get, most facilities have, like our facilities, we do a lot of screening whenever we go to the community. So screening has been made cheaper. The materials we use for screening are also very cheap, okay? That's because of subsidization through government and also through just partnerships with different individuals, different organizations coming in and trying to make it cheap for everyone. So most places, when they go for screening, especially when people are going to the community, they're not charged at all. But if you go to hospital, you'd find that it might be less than 1,000 shillings, okay? Getting screened for all these cancers. So I think currently we are in a good place. We still need more people to go out and get screened, and we need to drive that screening. Yeah.
And what can be done? Because you've clearly stated there's a challenge of screening. What can be? Is it the lack of awareness in the country? What is contributing to the low screenings?
I think the lack of awareness, though we've been having programs trying to encourage people to get screened, okay, women to get, like tomorrow, there'll be so many hospitals doing cancer screening. Like I think the whole of January and February, we've seen a lot of hospitals giving free screening, especially for cervix and breast screening. What can be done is we need to involve all the stakeholders because prevention is better and it's cheaper compared to treatment. So we need to have everyone involved. We need to have the government, the stakeholders, the hospitals, the organizations, the NGOs to come in so that we can find a way to make it cheaper for everyone and also to create more awareness. We're still not there. We need to create more awareness. More people need to understand that screening doesn't mean you're going to get cancer. It just means we need to catch it early or to prevent it. Yeah.
And is there a difference between screenings and checkups?
Well, I'd say there is a difference. Well, when we say a checkup, checkup just means you're going to the hospital to see a doctor who will probably do a number of tests and examine you to find if you have any other conditions. But screening in itself, we're focusing it more on cancer. That means the doctor will also examine you. They'll also do a number of tests. And this is to either first to check if you have cancer or to prevent the cancer before it happens. So the difference is that for checkup, it's general, but screening is more to the cancer patients. Yeah.
And in terms of the advancements that we have made in this particular sector, treating this particular disease that has taken and robbed us of fathers, mothers, and even kids, at the end of the day, what advancements have we made, not only as a country, but in this particular field globally?
We have really advanced in terms of advancements in cancer treatment. Especially in our country. I'd focus more in our country because I'd say, I give an example in terms of just getting the diagnostics. About 10 years ago, our country didn't have any PET scan. And a PET CT scan is very important when we are trying to diagnose and also treat cancer. But currently, we have about 4 or 5 PET scans in the country. Okay, we're looking at newer techniques in treatment. Like, for example, in non-invasive techniques like radiotherapy. Okay, we are seeing that nowadays we can do techniques that were never in our country. We are also having patients coming from other countries just to get treatment in our country. So you can see we are advancing at a really high rate. We're also looking at things like immunotherapy, things like targeted therapy. These were not there about 10 years ago. But currently in our country, we have facilities that are able to give you immunotherapy. They're able to give you non-invasive radiotherapy. And this helps in the treatment and survivorship of cancer. Yeah.
Now, you see, you've just talked about some of the ways that you can curtail that particular disease, but the issue with many Kenyans is the affordability of such treatments that you're talking about. Aside from the social health authorities, key stakeholders such as yourself and other stakeholders who are in this particular medical field, what can be done to ensure that if today I have cancer, I am confident enough the monies that I will be asked in those facilities will not make me sell my land, will not make me sell my house so that I can get that particular treatment.
I agree with you. Cancer treatment is very expensive. As I said, cancer is what we call a chronic disease. That means it stays for a long time, and all this time you probably need treatment, you probably need follow-up, you probably need some tests, and that contributes to it making it very expensive. I'd like to say that, okay, apart from SHA, but SHA has done a lot, especially in terms of treatment for the cancer patients. It has created accessibility, and it has also allowed people to get treatment without spending out of pocket. Well, there are also other organizations like Faraja, which helps cancer patients who are not able to afford their treatment. They come in and they help patients to, they contribute some money to the patient, and the patient can be able to receive treatment.
And all that comes with a stigmatization, which we have witnessed, because what are some of these myths that are associated with cancer you have heard as a doctor?
Oh, well, there's so many myths, especially involving around cancer. Some people believe cancer is witchcraft. Just because you're feeling or somebody's disfigured or you're very sick, some people would say it's witchcraft. No, it's not. It's just that you need treatment. And also, some people also believe cancer is contagious. Cancer is not contagious. That means if anyone in your family has cancer, your chances of getting cancer just being exposed to them is zero. Okay, and also cancer is not a death sentence. Most people think once you get diagnosed with cancer, you're done for. No, if you get diagnosed with cancer early enough, you can actually be treated for it. And for the advanced stages, I've seen people who have been on treatment for years, for 5 years, 10 years, and they're doing really well. So cancer is not a death sentence. Okay, if you can go to hospital, you can see doctors, and in our country, I can say like in our facility, cancer care, we do have these techniques, we do have these treatments available for people, and people can live for longer. Yeah.
And in terms of stigmatization, is there psychosocial support at the end of the day? Because you see these patients, even if they have been able to be cleared by the doctors that the cancer has been contained, you're free to go, still they're being stigmatized by the society. So is there psychosocial support afterwards? Because we know if somebody is stressed or have depressed, it can cause to low immunity.
That is true, that is true. Currently, we do have social support, but we're not where we really need to be as a country, though in some facilities it is available to the patients. You see, for cancer treatment, we're not focusing only on the medication. We're focusing on the patient as a whole. We're looking at the nutrition of the patient. Okay, we're looking at the mental health of the patient. We're looking at all these things, the community of the patient, where they're coming from, their caregivers. So it's very intense and intensive. We need to create more opportunities for patients to get this psychosocial support. There are many, as I said before, there are many organizations like Faraja, which we have partnered with, and they help with this, okay? For patients who are going through cancer treatment, they need all this, and Faraja is an NGO, they don't need to pay anything, and they can get access to all this. Yeah.
And back to the advancements that we have made, because many people have been asking and they have been clearly talking about it, will we ever find a cure for cancer?
Well,
I know it's a mouthful, but because that is the hope of many other people.
Yes, that's true. That's true.
World. Yeah.
Well, what I can say is, I can't, but from where we're looking at, where we were 20 years ago in terms of cancer treatment all over the world, and where we are right now, the advancements are so big. I can't really point out and say there will be a cure for cancer in the future, but we are heading in the right direction. A lot of research is going on in terms of cancer treatment, and we are seeing positive results. Yeah.
And what are some of the challenges, like medics such as yourself and other people in your in this particular sector who are your colleagues? What are some of the challenges you're facing for you not to treat this cancer better?
Well, there's so many challenges, but I'd focus on a few. One of them is just having the human resource or the manpower to be able to diagnose and treat the cancer patients. We're still below, we're still really below the recommended in terms of specialists, in terms of nurses, in terms of doctors, nutritionists who are able to come in and treat these patients. Second is, well, Nairobi is privileged, but when we look at other areas across the country, just getting access for the patients to get access to the basic tests that we need to help us to diagnose the cancer is a challenge. We don't have enough labs. We don't have enough CT scans or enough machines to help us diagnose the cancer. So that becomes a challenge. And third thing is financing. Even though we have SHA, not many people are, not many people have subscribed to SHA, and that makes it very difficult. And asking them to pay money out of pocket, and cancer treatment is very expensive. So we see it's a struggle for both the doctor and the patient. Yeah.
And what could be some of the solutions maybe you could have fronted to address some of those challenges you're just talking about?
The solutions are, we really need to train more people. we need to have more specialists in the country. We need to make sure that the mashinani areas, we have people who are trained to recognize and treat cancer, okay? We also need to invest more, okay, in terms of labs, in terms of diagnostics. We need more machines to help us detect the cancer early. We need to invest more into the healthcare and also into cancer treatment. Yeah, so basically those are some of the solutions, but I'd also encourage, we really need to do a lot of awareness. We really need to have campaigns, I think even every month, just so that people can understand more about cancer, okay? Yeah.
And in terms of the advancements that we have made aside from the medical side, but how has technology been key in helping you medics detect some of these diseases and possibly treat them?
I'd say that technology has come and has helped a lot. First of all, we're looking at newer methods that are more precise in diagnosing cancer. As I said before, we have PET CT scans in our country, which help us a lot in terms of understanding the cancer and how far it's gone. Second thing is we have newer methods of screening. Like for cervical cancer, we have the HPV DNA screening, which is something that you can do it at home. It's faster, it's more convenient. We're also looking at the newer drugs that work faster, that have little side effects to the patient. And they work better. So all this coming in, we're looking at the advancements are really big and they're really good.
And we know the negative side of technology itself, because we have seen many people rushing to Google instead of asking you. So what are the dangers of that?
The dangers of that is, first of all, you might get wrong information, because as you see, Google gives you general results. They don't really give you data that is already reviewed. So anyone can just post anything, and that might give people the wrong impression, okay? A lot of myths and misconceptions come from people just going online and just Googling, and you get all these people talking about ways in which you can treat cancer or without medication or doing other different things. So it's very dangerous, because this is not proven data. You need to go to the hospital where there is a doctor or where there is a specialist who has been trained for that.
And in terms of linking up, what are the needs of the market, especially you doctors, linking the market and the universities where people get those degrees and study for many years, we know 7 to 8, even 8 years. In terms of linking those two to ensure that the services that you offer as a doctor is something that you had studied in the classrooms, is there that bridge between the curricula and what you're practicing?
Currently the curricula is very, because you know, when we are looking at cancer treatment, it needs a specific specialist. And in our country, currently we have training for specialists who treat cancer. We have specialists, nurses who are going as specialists in treatment of cancer. So in terms of training right now, we do have adequate training for cancer treatment. But I'd say we need to increase the number of universities that offer this training. Currently, I think it's the University of Nairobi only offering the specialty training, but we still need more universities to be funded to come up and train.
Because the reason I was asking that question, you said you are not many in this particular field. Is it that people do not want to venture in this field, or there are so many to the extent they do not have job opportunities within the market?
There are not many. I'd say that, first of all, as you said, it takes a long time to train. That's like 6 years to do the general medicine and then 4 more years to specialize. That's about 10 years in terms of training. The training is also very expensive, and we need also the government to employ more of the specialists, okay? Because we have the specialists, but some of them are still not employed. Yeah.
And given that we're entering the final leg of our conversation, maybe give us experiences, because I know you have worked with cancer patients.
Yeah.
Maybe tell us those uplifting stories that you saw and you were able to treat at the end of the day, and how they're currently responding to the society, how they're working, without even revealing, of course, the patient's name.
Yeah,
because of confidentiality.
There's so many stories I can give you. I've worked with patients for the last 4 years who are diagnosed with cancer. You know, you'd meet just a lady who has breast cancer, and at first she comes in, she's scared, she's thinking, is it the end for me? And then they just start treatment, and you can see the response to treatment is very positive, okay? They're also, once they do all the treatment and they do all the scans, and the cancer is, they don't have cancer anymore, it's one of those stories where you really feel good, and you can see the advancements we have in our country in terms of cancer treatment. Yeah. So most people who are diagnosed with cancer, it is usually a very scary diagnosis. You can see how it affects them, but with enough support, enough social support, enough medical support, you can see patients taking treatment and living for longer cancer-free. Yeah.
Now, the other question, going back to academia and what the market needs, in terms of brain drain, we know majority of the doctors, if they do not find opportunities here, they normally go abroad, especially they like going to the United Kingdom, even the exchange between Kenya and countries such as Cuba. So do you fear that that we'll lose more doctors going outside the country, yet we do have a need for them here?
That is one of our greatest challenges, because as you can see, with the delays in, let's say, posting of the doctors and employment, most people tend to look for greener pastures, because now you've trained for, let's say, 8 years or 10 years, and you still can't find a job. Well, there are other opportunities abroad. So we really want to, if it's possible for the government and all the stakeholders to come in and address the issue, will be really good, especially for the people of Kenya. And
as we wind up, talk to us about, given that you clearly stated there are a lot of challenges in that particular sector, is there a miss where we're missing policy, or is it that the policies are there not being implemented? And also talk to us about the issue of, we're talking about the specialization of this particular field as we wind up.
Well, in terms of policy, currently what I know is the government and all the stakeholders are actually trying to create policies that are beneficial in terms of cancer treatment. We have organizations like the NCI, the National Cancer Institute. They are involved actively in trying to create these policies. And they have brought in all the stakeholders, they have brought in all the specialists, and we are all trying to just come in and find the best way we can treat cancer.
Okay, give us now your final remarks, given that Kenyans are watching you right now. And of course about tomorrow as well. So
I'd like to emphasize that, one, we need to go for screening. We need to go to hospital for screening. For ladies, breast screening and cervical screening. I also want to mention that we have the HPV vaccine for women, and it helps prevent cervical cancer. So that is very important. I'd also want to say that cancer, getting a cancer diagnosis is not a death sentence. Most people, if it's detected early, you can get treatment and you can live a normal life. Yeah.
Thank you so much, Dr. Joseph Mageto. He is a resident doctor at HCG Cancer. Thank you for making time for us. And of course, we are waiting to see how the awareness Kenya will join the rest of the world in marking that particular feat. You've just heard from the doctor. It is not a death sentence with the advancements that have been made, not only in treatment, but in terms of the awareness itself of this particular disease. It is not a death sentence. He's urging many of us to go for those screenings, and we should not take granted those screenings, because at the end of the day, early detections mean it could be prevented better. That concludes our conversation this morning. Tomorrow we'll be having a 2-hour session as well, so do join us. We'll be revealing some of the topics on our social media platforms, so go there so that you can, even if you want to rewatch the first segment and the second segment, you can go to our YouTube channel at KBC Channel 1. My name is Abdiaziz Hashim. The sign language interpreter at the bottom end of the screen is Lucy Mora. Don't go too far. Khalid Abdullah is up next with Kurunzi Mashinani.